Welcome to the channel. This is your San Antonio chiropractor. Remember to like, comment, and subscribe.
Be talking about some x-rays. This patient is about 50-year-old male. He's a bookworm. He's a multiple PhD, very, very big guy, probably about 300 pounds, 6'3", 6'4". Spends most of his time leaning forward. We took x-rays of him. We got cervical spine series, lumbar spine series. As we look at this one, this is the AP, so this is us looking at him straight on. What we're going to see is a whole bunch of facet arthritis. On the next view, we'll see some stenosis. And then when we get to the low back, it's going to be pretty boring. Oh, also in the neck, he's got some dish. Now, something to note is these x-rays of the neck are new, whereas the low back x-rays are old. They're the lumbar spine's about 4 or 5 years older than these of the neck. I have an MRI of his low back, but it's just too difficult to get. It's somewhere in my brother's organization area. He's a medical doctor, so we're co-managing this patient, and it's not easy to access for me. So I didn't show it. This is us looking at him straight on, okay? We want the side of these vertebrae to be nice and smooth. So we want nice smooth edges. So as we go down this right side, we want nice smooth edges. Looks pretty good. I'd probably say about mild facet arthritis on the right side. We go to the left side, looking pretty mild, and then all of a sudden it starts getting real big. This is kind of like Mount Kilimanjaro right here, okay? You see these crazy, crazy, crazy lines sticking way far out. Now, that's facet arthritis. What the facet joint is it's the joints that the neck glides on. It's this little area I'm showing you. This is kind of what it should look like, especially at 50. You go to the other side, and you see this massive glob. See how it's way wider? The width, as facet arthritis grows, it's the joint line being upset. It's going to grow and get bigger and bigger and bigger. It's going to increase in size, but also it's going to make these joint lines very irregular shape. That's why you see how crooked they are. Now, as we go down his spine, we want it to be nice and straight. It takes a little bit of a turn. So he has an old injury right about here. That's what a little bit of this bump is. Yes, some of it's a little bit of heart shadow, but he does have some osteoarthritis to that segment. He has pain in this area. But that pain is also created from the cervical spine, from the stenosis that this facet arthritis creates. At these lower levels, it mimics pain in this area, between the shoulder blades, along the rhomboids. You'll get burning, and it'll feel like some weird little leprechaun sitting on your shoulder pouring hot tea down your back. It's a weird sensation. You'll feel like you have a rib out of alignment. We get that quite a bit. Let's jump to the next view. This is us looking at him from the side. So teeth are over here, ears right here. There's the ear canal. As we go down, we drag that line straight. We make a perpendicular line all the way down. It's almost in front of the shoulder. Remember I said he's a big guy, so his shoulder's probably about right here. So this is some forward head posture. It puts a lot of pressure on the lower cervical spine, which we can't see through his beefy shoulder, okay? But you can just imagine what this leveraged arm is doing to his spine. It's putting all that pressure on the upper thoracic spine. As we go down back these vertebrae, they all line up nice and perfect. It's good. And then we look at disc space. We want them to be relatively big, but remember he's 50 years old, looking good, looking okay. And then C5, C6, probably most likely disc herniation or pretty nasty disc bulge at that level. In the front of the vertebrae, we have some mess going on, some noise. This is DISH, diffuse idiopathic hyperskeletal osteosis. All that weird word means is the ligament in front of the vertebrae calcifies over, and it tries to prevent the neck from moving. Why this happens, nobody knows. About 30% of the people with diabetes also have DISH. He's got diabetes. Chiropractic works wonderful with DISH. What chiropractic does is it helps prevent these segments from wanting to fuse together. So the ligament spanning between calcifies, eventually fuses. This patient's been adjusted for about 30 years, maybe 20. My dad used to treat him back in the day. I've been treating him for about 3 years. This dish is a pretty new finding on him. You can see how there's little lines along it. There's a little line right here. There's little gaps. Those are areas that he has his range of motion back. That's what chiropractic does for these patients. Now, he has horrible facet arthritis. This joint line's huge. They're very, very thick facets. As you get arthritis in the facet joint, it grows in length, okay? This joint surface should be nice and smooth. They're a little bit irregular. That's why the old lateral Palmer brake, Palmer rotary brake, cervical adjustments, or any type of rotation usually doesn't work well with people with severe arthritis. It can be a little difficult sometimes. A lot of times it works, but sometimes it's a little hard. That's why with these patients, you usually have to start with toggling, adjusting straight from the side of the neck, going lateral to medial, opening that joint line a little bit, getting it loose, and then you can do some rotation. Something to note, you see this little hole? That's where the nerves of the neck come out of. That's where the spinal nerves come out. That's where the spinal nerve's coming out. Now, the spinal nerve's like the size of a linguine, okay? Ain't no linguine coming through there. Maybe this bottom one, but he's got a little bone spur. So these facet joints, as they grow in size, they make this canal that's supposed to be there even smaller, okay? If we had some oblique views, you could see it a little better, but we don't. So this facet arthritis, it grows and it also pinches on the nerve. And then whenever you have a disc issue, the disc pushes this way, and then you have that whole canal of the structures that are creating the canal growing in size, pushing on it from the back to the front, and you get the disc pushing from the front to the back. So it's one of those I eat because I'm fat and I'm fat because I eat situations. So everything makes it worse. Getting adjusted, though, opens those joint lines. It lets the area breathe. It lets there be range of motion. It allows the nervous system, the spinal cord, the nerve roots to move and deal with the problem that you do have. It takes the inflammation out of those joints. It helps. So if this is you, you need to get your butt into the chiropractor. We're looking at this patient straight on, okay? We want the spine to be nice and straight. Looks good. Like I said, this one's going to be boring. Sacrum, the width, we're just comparing both sides. Lines up perfect. One side's not too much bigger than the other. Iliums, we put a dot right there. I like to drag it across. Lines up perfect. Femur height, we drag it across. Lines up perfect. Like I said, he's a regular patient. Pubic symphysis goes straight through the butt cheeks. That's wonderful. We see a little bit of calcification right here, and then a little dot, a little dot. I thought I saw some calcification there. Yeah, right there. Most likely vas deferens calcification with this diabetes. Could be phleboglyphs, but nothing to worry about, okay? I looked at the obturator foramina, this hole. This is what it should look like in a male. In a woman, it should be a little wallered out. Now we look at the right side and see how it's huge. That tells me, and then this bone is massive compared to the other one. This tells me that this bone's pushed forward. It's away from the bucky when we were taking the x-ray. So it means that his lower right ilium is rotated forward. So it tells me his hip is a little bit out of alignment. But we know it's not nasty because everything up top looks nice and square. Let's jump to the lateral. This is us looking at him from the side. We want the back of all the bones to line up. They stack perfect. Back of all the vertebrae line up perfect. It tells us no spondylolisthesis. Nothing's broken. Everything's okay to play. We look at the disc space. We want it to be nice and big. Looking good. And then all of a sudden we get to L4, starting to get a little bit smaller. And then we get to L5, S1. This should be the biggest disc in the body, but he's like the tiniest on him. So this is the segment that bears all the weight, the true sciatica situation. So pain down the back of the leg. Segment above, pain kind of down the side of the thigh. This guy co-manages between epidurals and chiropractic for this lumbar spine pain. He's got a pretty nasty disc herniation at this level. L4 is more of a disc bulge, but it's a bilateral, These holes, we want them all to be nice and huge. That's where the nerves come out of. And then you see this one. See how it's kind of tight? That one should be massive. But he's got a little bit of bone spur. We know he's got a disc herniation. Those are all things that narrow and make that hole tighter. When that hole gets tighter, the nerve can't wiggle around. There's not enough room. There's not enough space. Any inflammation that occurs just makes it even tighter and causes pain. Here's us looking at his oblique. A little bit of facet arthritis here at the L5S1. I'm sorry, at L5S1. Not terrible, but there. As we go up higher, it looks better and better. Joint lines on the femurs looks really good. Boring. So we go up here. We want nice sharp joint lines. A little bit of arthritis, but like I said, he's looking good. You can see some of this early dish starting to happen. Again, remember this one's like from 4 years ago. So you can see a little bit of evidence of it wanting to occur. But this is a segment of a series I want to start doing of showing the oddball x-rays of the week. Let me know what y'all think, and please like, comment, subscribe. We'll see you soon.